Hi, my name is Scott Revlin, and I'm the Clinical Director of Alternative Behavior Strategies Ventura County location. Today, I'm going to give you an introduction to ABS, to applied behavioral analysis, and also what your treatment team from ABS will look like. So we're going to start off with some history of ABS. ABS was founded in 2012 in Utah by our president, Jeff Skibitsky. Since that time, we've now established 9 offices nationwide, and we serve over 1,000 clients from those 9 locations. We are rated as one of the highest quality providers in the country by the Behavioral Health Center of Excellence. They are an independent entity that assesses and audits ABA providers, and we're very, very proud to be rated in the top 10% in both treatment quality and staff satisfaction nationwide. The mission of ABS is to provide ABA treatment, diagnostic assessments, and other psychological services, primarily to those with an autism spectrum disorders diagnosis, but we also treat other diagnoses as well. So, some history of applied behavioral analysis now. Applied behavioral analysis, simply put, is the science of effective and efficient teaching. We only get to work with your kids for a few years, so it's very important that we get maximum payout and the child learns everything they can as quickly as possible. So ABA is specifically designed to be a very effective and efficient form of teaching. There's over 60 years of research supporting ABA as an effective treatment for autism spectrum disorders. It is really the only treatment that has been recognized as medically necessary for autism spectrum disorders. As you watch your therapist work with your child, you'll notice that we do a lot to maximize motivation to perform desired behaviors in lieu of maladaptive ones. So this will involve providing lots and lots and lots of reinforcement reward for using language appropriately, for asking for breaks appropriately, in lieu of doing all the stuff that your child may be doing up to this point, tantruming in order to get needs met. ABA is usually provided across environments. Wherever your child is, that's where we should be teaching. So primarily we work in homes, but we also provide treatment in the community, trips to the grocery store to practice waiting in line, practice holding hands in the parking lot, as well as any other relevant setting, the park, swim lessons, schools. And in those settings, we are going to focus on teaching to all areas of behavioral excess and deficit. So most of the children we work with present with deficits in communication skills, in socialization skills, overall deficits in cooperation and flexibility, daily living skills, things like washing your hands, eating a variety of foods. And then for all the children we work with, we're working on reducing those problem behaviors and replacing them with things that are going to be more desired. So you may be asking yourself, how much ABA therapy does my child need? So there's been a lot of research on this. The graph you see up on the screen is what's known as a meta-analysis, and this is a combination of many different studies that have been published on ABA and specifically with children with ASD. And I invite you to pause the presentation and look closely at the graph for a few minutes. But each one of those blue dots represents a different study where ABA was used as a treatment for autism. And what you can see, if you look across the x-axis, we have number of hours per week that those children received in those studies. And then over on the y-axis, on the up and down axis, we have the change in IQ score that came along with that intensity of treatment. So what we're seeing here is a very, very clear dose-response relationship between the intensity of treatment and IQ change. Basically, the more treatment you get, the more IQ points you get. So as part of your child's initial assessment with ABS, your consultant will be making a recommendation for number of treatment hours. This will be based on a variety of factors, from your child's level of functioning to your child's availability, and also just to your family's needs. And we'll make a recommendation for an intensity of treatment that matches all those things. And whether we recommend 40 hours per week or 10 hours per week, the goal really is to create a 24-hour therapeutic experience. We want every waking hour to be a learning experience because that's how neurotypical kids learn. They're like little sponges. They just soak up information whether you want them to or not. So we want to mimic that same experience in the children with ASD that we work with. All right. So once your consultant has generated that assessment report with the intensity of treatment and also with recommended goals for all of those goal domains that we had talked about previously, ABS will assign a treatment team to you. The person that you'll see most often, the person you'll see daily, is your registered behavior technician, or your BT. Your BT will be in the house daily or the community daily, whatever setting you're working in, and teaching to all those goals that were established in that assessment report. Overseeing your behavior technicians will be your consultant. Usually, this is the person who conducted your initial assessment as well, but that's not always the case. And your consultant is going to modify curriculum weekly, do parent education with you, and generally keep the program on track week to week. Supervising that consultant will be your clinical director. Your clinical director provides clinical oversight and review for all the programs, all the kids who are in their care. And you can access your clinical director at any time for any reason, but you'll typically see these people during IEP meetings or other important things that pop up throughout the year. And then finally, we have our management and administrative team. These people, although you're not going to see them out of your house, are very important as well. These people will liaison between you and your insurance company. They may help with scheduling matters on your team, anything behind the scenes. These would be the people to contact. So I hope you've enjoyed this presentation. Welcome to ABS. We're glad to have you as a client. If you want any more information about what we've talked about today or just anything else related to ABS, please don't hesitate to go to abskids.com. Thank you.